So this month I did things just a little bit different. So normally what we do is we discuss, some topics. I kind of choose which one I feel is pertinent for that time, and then I do the research and go on and talk about it. So this time what I did was I actually asked some of my coworkers, family and friends, and tried to get some thoughts from them about what common misconceptions about mental health and mental illness. So, just common myths, if you will, that people have heard or think about mental illness and mental health, so that I can try and stop the rumors from flying and get the right information out there. And it was actually really interesting to see how common some of the answers were, that the same people were saying some of the same things. So um, I have just a quick list, maybe 5 or 6 different things that people mentioned that I thought would be good to talk about. So the first one is actually very surprising. So several people told me that they did not feel that mental illness was all that common. They felt that there were other things that needed to be brought to the forefront and that it wasn't that common. They were kind of, why are you even asking? It's not something I think about very often. It's not something I hear about. I don't know many people who have that problem. So they just felt like it wasn't very common, which I think we all probably know, but unfortunately, this is very not true. So, mental illness is extremely common, and unfortunately, you know, it was uncommon pre COVID, and now throughout COVID, and I guess at some point will be post COVID. Um, I expect the numbers to just continue to rise. So, as of right now, and again, these are pre COVID numbers, okay? We don't have any real statistics on this last kind of 12 to 14 months. We're kind of waiting to see. But pre COVID, the numbers were pretty interesting, that 1 in 5 adults in the US has been diagnosed and treated for some mental illness. The most common being anxiety, the next one, depression, also like very specific phobias tends to be a real popular diagnosis as well. So, unfortunately, it is very common, and again, only getting more and more prevalent with everything that's been going on as far as quarantine, isolation, fear, anxiety. It's all just going through the roof. I know at this office we have definitely seen an increase in patients and people seeking treatment. So yeah, 1 in 5 adults in the United States actually has some issue with mental illness. The next myth, people often said therapy was really useless. So why bother with therapy when you have medications that can help to take care of it? I'd rather just pop a pill. Why waste my time? Okay, so this is common as well. A lot of people are not open to therapy services because I think it's more misinformation. Therapy is whatever you make of it. So if you want to go into an office, lay down on the couch, talk about all of those feelings, and about your childhood, or, that's fine. That therapist will help you with that and guide you through whatever you need to talk about. But if that's not what you want or what works for you, then you need to find the therapist that does what you want and what works for you. The therapist should be there as a guide to sort of help you talk through whatever it is you need to. So if you have a lot of anxiety, they should be able to help you talk through your anxiety, what happens, and provide you with tools on how to cope with that anxiety. Medications do work, but as I tell almost every single patient, this is a band-aid. Okay, the medication will temporarily help your symptoms. It is not going to fix a dysfunctional family, take away trauma that you've experienced for years on end. It's not going to, fix a relationship that's been broken. It doesn't do that. So it basically just kind of bandages the symptoms to make things more tolerable while, you're getting through, hopefully in therapy, you're working through how to cope and deal with those situations. So I always really, really encourage my patients. This office does not require that you are in both therapy and medication management. Some offices do. They will not prescribe you medicine without showing that you're also participating in therapy. We don't do that, but we do strongly encourage it. We try to really help people open up and tell them that really your long-term positive outcome is going to be coming from medication and therapy services together. So that's that. So again, that was unfortunately something that people mentioned that is not true also. There are several people who believe that mental illness is just a sign of weakness. This is just part of your character. You're just not strong enough to handle it. That again, also very untrue. Mental illness has nothing to do with your personality. It is not a character flaw. I tell this to patients all the time. This is not a character trait. This is not any of that. This is a chemical imbalance in your brain. This came from biological, beginnings. This is both genetic or hereditary, whatever you want to call it. So, that definitely plays a role. Previous experiences, past trauma, physical illness, all of these things can be factors in whether or not you may be at a higher risk and experiencing mental illness. So, if you're asking my opinion, which strictly my opinion, people who go through mental illness, reach out for help, and get through it are probably a heck of a lot stronger than people who have never had to deal with it, because mental illness is not easy. It's not easy to go through, and with everything that goes along with it, the stigma, everything that's attached, people who get through it and really, fight for themselves and stand up for themselves and get help, are very, very strong. They really are. They should be applauded for being able to just, do that. So it is not a sign of weakness. People think mental illness or mental health problems are permanent. This again, for the majority of people, this is not true. I get asked all the time, how long am I going to have to be on this medication? The truth is, I don't know. What we generally tell people, as a general guideline, once we get you on the right medication at the right dose and you are stable, right? Your symptoms seem to be very well controlled, everything is pretty tolerable, you're able to function through your day without experiencing a lot of symptoms. Once we get you to that point, we really recommend you stay on that medication at that dose and continue to be kind of monitored for about 9 months. Some people maybe even up to a year. But around that time, the 9-month mark, if you're still feeling really stable on those medications, we can discuss if you're interested. Maybe kind of weaning down on your dose and see how things go. But it's important that we find that magic medication and dose that really works for you, because then when we start to wean you down, if we notice that symptoms start to reappear, we want to get you right back at that because we know it worked well for you. So we usually tell people expect to be on the medication between 9 and 12 months. And then at that time, we can discuss kind of, weaning you off of the medication. We don't want to abruptly stop medications ever. Some are easier to come off of than others, but for the most part, we don't want to stop abruptly ever anyway. So, but about 6 to 9 months. Now, there's a lot of people who can get off the medication, they do really well for a couple of years, and then maybe something happens, or maybe nothing happens, but they start to notice the symptoms are coming back. So, you come back, hey, I've been doing really well, but now I'm starting to not feel well. What can we do? Okay, so we know what medication worked for you before. Let's start that back up. Let's see if it helps again. Sometimes it does. Sometimes it's, super simple. We can kind of put you back on that same medication and, get you back up to that dose. You're good for another year or two on the medication. Maybe you decide to stop it again. So some people have these times where they don't need the medication. They do really well. They're pretty much symptom-free without it. And then, for whatever reason, they go back on it. So some people can go years in between. Other people, they just need to stay on their medication all the time. It's just, like I said, it's a chemical thing. It also depends on if you've, been engaged in therapy services. Did you learn coping skills? Are you using those coping skills? Have you had any life events? Did you go through a divorce? Did you have a death in the family? If there's something traumatic that happened, obviously that's going to exacerbate symptoms and kind of change the course as well. So it does not mean that, mental illness is permanent or that you have to be on medication for the rest of your life. That's not what it means. Usually it's a temporary thing, and you learn to work through it. You learn how to cope, and you're able to kind of eventually move forward and don't need medications, don't need therapy. But you have to put in the work to get to that point. So, and many people do come back and need help again, and that's fine. We always tell people, when they feel better and they're off their medications and they get discharged from therapy services, we're here when you need us, let us know. And sometimes, again, it's easier because we already know what's worked for you in the past, so sometimes we kind of are able to get things better a little quicker. So, but it does not mean that all mental illness is permanent. Most people will recover. Most people, are on this medication regimen very temporarily, and then, like I said, they go on to never have to be really, seen again. It's just a rough patch that they needed a little help getting through. So, another one that was fairly popular that I was kind of surprised to hear: people think children don't experience mental illness. I think here the misconception is it is often very unlikely that anyone who is under the age of 17 is diagnosed with any serious mental illness. So schizophrenia, psychotic disorders, bipolar disorder. It's very difficult to diagnose those in anyone young. Late adolescence, early 20s is when those tend to be more diagnosed. That does not mean that children do not show symptoms of mental illness. I treat children as young as 6 years old. I have a couple that I treat for anxiety and depression. Again, it's a chemical imbalance, but sometimes kids have trauma in their lives, even at that young of an age, and may need some help getting through. I can tell you that we really encourage the younger the patient, we really encourage them to also engage in therapy services if they're going to be on medications, because it's just so beneficial. Because at that young age, we can teach those coping skills, we can teach those relaxation techniques, we can teach all that and help them face whatever is happening, so that as they grow up and they get older, they know how to handle it, and they know how to handle stressors and anxiety and fears and things just a little bit better. So children do experience mental illness, and there are plenty of children who do experience more severe symptoms. They can become very defiant, oppositional defiant disorder, conduct disorders. Tons of kids are diagnosed with ADHD all the time, which is considered a mental illness. A lot of us don't think of it as that, but technically it is a psychiatric disorder. So kids get sick with mental illness just like adults do. I think it's harder to diagnose because they're not always able to verbalize and explain exactly what they're feeling. And a lot of the symptoms that they display are different. So, they can act out behavior-wise when they're anxious. They can have physical symptoms, their stomach's upset all the time, they complain of headaches all the time, those kinds of things when they're anxious. So it's just a matter of being able to see, what's more common in which age group, so that they can be properly diagnosed. So children do have mental illness. It's probably much less frequent than adults, but it does happen. So that was another one. So I don't know, I'm interested to hear if anyone else knows of any myths or common misconceptions about mental illness, because those were the majority of the ones that I heard. The only other one I heard was about bipolar disorder, and the word bipolar gets thrown around all the time. People will say, "Oh my gosh, I'm so bipolar. I was cranky this morning, and now I feel great." So they throw around the term bipolar as if it means, you just have mood swings, which is not true. Bipolar disorder is only diagnosed if a person has either experienced a manic or hypomanic episode, which are very extreme, elevated moods, days on end without sleeping. You usually need medication or have to be hospitalized in order to come back down. So, bipolar disorder is more than just a mood swing. They're often not frequent. They go days at a time in these elevated manic states, and then they go days at a time the opposite, where they're so depressed they can't get out of bed, they can't shower, they don't take care of themselves. But we see bipolar, the word thrown around all the time. So that was another common thing that people mentioned was the word bipolar. Just everybody thinks they're bipolar because they have mood swings. So that again is not necessarily true. It's something that you really need to be evaluated for. There's a lot of questions you have to answer and talk about to determine if you really are bipolar. So that's it. That was the majority of what I heard from people when I asked about, just kind of misconceptions or things they had heard about mental illness. But again, I'm interested. So if anyone knows of anything or has heard anything that they'd like to know, whether or not it's true or false or, some sort of myth of mental illness, please comment or feel free to email me and let me know. As always, please go online, whatever social media, Instagram, Facebook, and find the Love Well Foundation and take a look at all of the things that they're doing so that you can help. They have some amazing things in their shop. They're doing some really, really awesome fundraising, and they have their walk, their move for mental health coming up. So take a look at that as well. Otherwise, feel free to contact me anytime. My email address is here for you, and I hope you all enjoyed this episode, and I will talk to you next month. Have a great one.